and I'm a gynecologic oncologist. So we are not part of the team, but as OBGYN, we are the ones who usually, because the female patients come to us. So our job is to screen the patients, and we refer the patients to the general surgeon and the med onco also, and as their multidisciplinary team will come up with the best management for the patient. So there. And then I have other questions on my head, but I want to hear the rest of the report. Let's entertain one question. Um, uh, TS is asking, can a breast ultrasound determine if the mass is benign and the is benign or malignant? And what is the difference between a solid mass and a cyst?
Okay. Yes. Now, the ultrasound, remember, those are diagnostic. So that's why diagnostic meaning try to screen it and look which one this is suspicious or not. Okay. So therefore, ultrasound is one of it, of those gadgets, no? And then if you notice, they will give you the BI-RADS 2, BI-RADS 3, ganyan. The one who interpret it is the breast radiologist. Okay, let's go straight to your question. Can ultrasound make a diagnosis? No, cannot make a diagnosis, but can suggest based on that BI-RADS classification. They will tell, let's say they make a conclusion, BI-RADS 4. If you look at the BI-RADS 4, suspicious yan. But it cannot tell you is cancer benign or malignant. So it's the obligation of your doctor. If the presentation is BI-RADS 4, then the next step is biopsy. Okay, so it can give us an idea, maybe this is suspicious, but cannot make the diagnosis 100%. No? So ano pa yung second, the difference between ano,
A
no?
solid cyst and a solid.
Solid mass and cystic. Okay. The difference is usually seen in the ultrasound. Kasi di ba kanina in my lecture, that is one advantage of the breast ultrasound, can distinguish between the cystic and the solid. Based on the shadow, okay, the one who interpret it is the breast radiologist. Yung they call it hypoechoic, hyperechoic, mga ganyan. Specific coloring in the ultrasound connotes a certain idea. If this is solid, they are darker. When they are faint, or they most likely liquid, cystic. So that's why the ultrasound will tell us if it is cystic, meaning may fluid siya. Solid, yan, buo, solid. But kung cystic, may capsule yan, but may fluid inside. Okay, so not all solid mass are malignant, but the breast kung cystic, more common they are benign. Ayan.
Yes, yes.
Okay.
So so for our lay and also maybe our general doctors, like when you have an ultrasound and it says it's
Yeah.
cystic, most likely it's benign. If it's solid, most likely it could be malignant, but there are also solid that are benign.
Yeah.
So the point is the final arbiter is actually the biopsy. So for solid tumors, for cancers, we base our diagnosis on the actual biopsy. So we don't conclude with diagnostics, we just have an idea, then the biopsy is the final arbiter. That's why the pathologists are important to us. Since we're on the topic of a breast ultrasound, you know, sometimes in the clinics, my patients, they just have breast ultrasound. For the screening, do we use breast ultrasound for screening for breast cancer? Or is
Okay.
it mammogram?
Yeah. The standard is worldwide ito is mammography. That's why in mammography, there is what they call screening mammography and diagnostic mammography. The difference is in diagnostic mammography, they can do, they call it a focus. Okay, if they're suspicious, then they will go zero in, they enlarge it, and things like that. Okay, but screening, they just have two views of each breast. Diba? So I think you notice that patient, you that, oh, they do it the craniocaudal and oblique view. Okay. So standard na yun. Now, the issue is, can you do mammography less than 40 years old?
Yes, yes.
The recommendation is 40 years old and older. When they are younger and they have a certain issue, we do not usually request for mammography, but instead as an ultrasound. So can that ultrasound, let's say 28 years old female, may suspicious siya or they feel a bukol, mga things like that. So I will not request for mammography, but an ultrasound. Can that ultrasound become a screening? Yes, at that particular age. Yes, that you can have an idea what is happening to the patient.
So for routine ultrasound, for routine mammography, from what I understand from the guidelines, the age of screening is 40,
Yeah,
40 and above. And so
40
when
and
the patient
older.
is 40 and older, then the designated test is mammography.
Yes,
However, if the patient has issues like maybe a lump in the breast, the better test would be a breast ultrasound,
yes,
something like that. Okay.
yes,
All
yes.
right. But in general, if we're talking about screening, 40 and above, the standard of care would be a mammography. Okay.
Yeah.
Okay. So that's good. So that's our first part of our discussion. Let's move on to the exciting part, the myths, the myth busters. Okay.
Okay,
Let's continue after
okay.
that.
So, uh, wait. Okay. So the first, negative mammogram means you do not have breast cancer. Yes or no? Okay. The answer is next. No. Why? Because there are 10 to 15% of breast cancer are missed on mammography. So it's not an absolute thing because, again, we should remember mammography, ultrasound, MRI is only an adjunct. They are just diagnostic, but they do not give you a final answer. Like Dr. Sicam said, the arbiter is always a biopsy. Okay? So a negative mammogram does not mean that you do not have a breast cancer. Some lumps can only be felt and not seen on mammogram because of the density of the lump. 26% of cancer detected last year were found on mammography because based on calcification. Based on calcification. Okay, next. Myth number 2. Finding a lump is the only way a woman can detect breast cancer. Yes or no? Answer? No, because some cancer do not form a lump, right? So a visual exam of the breast can often show symptoms that need to be reported to your doctor. For example, skin dimpling. Wala naman lump yun eh. Nipple discharge. You do not feel any lump. Okay? But it may be suspicious. That's why anything abnormal, I advise my patient always, you should be familiar with your own breast, no? So make a routine, you check your own breast at least once a month, not every day, because you do not, you may not be able to detect any abnormality. And the best way to examine your breast, if you are a regular mens, you have a regular mens, which is between 25 to 30 days regular, then you count your first day as day 1, and then your day 7 to day 10. You check your own self. And you take a shower, you soapy di ba? You have a soap in your body, and then kapain mo yan, ha? Including your kilikili. So you should be aware of your own breast. Okay. Next, myth number 3. Removal of the entire breast is safer than lumpectomy and radiation therapy. Oh. So, no, because it has been studied between the two, kina-compare yun. No, between the mastectomy, removal of the entire breast, meaning mastectomy, di ba? And then versus the breast conservation. This is the second. This is lumpectomy and RT. Uh, Survival is similar for patients who have breast conservation surgery and those who undergo total or modified radical mastectomy. The study was follow up, just came out several years ago. This patient was follow up to 20 years. They update the data, and they examined more than 20,000 patients and being followed up, and more or less similar. It's not exactly the same, but they are, when you discuss of 20,000 patients are being studied, a difference of 20 patients, it doesn't, is what they call statistically not significant. Diba? So that's why you have to understand even when we review the journals, you have to be critical on the data. Next, myth number 4. No history of breast cancer in your family means you never have to worry about having it. Because this is, you know, people always telling us, Doc, I'm the first, wala naman kami history sa family eh. Bakit meron? Diba? Bakit ako? Wala naman kami family history. The answer is, oh, even though you do not have family history, all women are at risk. Okay, last year, 76% of women diagnosed with cancer had no family history. What is the risk? The highest risk factor is just being a female yourself is a risk factor. Okay, so not the family history. Of course, the family history of breast cancer will increase your risk. But being just a female, you are already at risk of having a breast cancer. Okay, next. Myth number 5. A mother's family history of breast cancer is the only important history. Yes or no? Because this is very important, no? And the answer is, of course, no, because a father's history is equally important. Hereditary breast cancer is caused by inheriting a mutated genes from either your father or mother, because your genes, 50% comes from your mother and 50% comes from your father. Okay, so you are the mixture of both genes. History needs to include the previous 2 generations because hereditary breast cancer can skip a generation. Okay, so because for us, the doctor, we look into either the dominant or recessive. No, so if we study genetics, so there is genes that you inherited from your parents, either in dominant or recessive genes. So in the dominant will express itself immediately. Recessive, no, it will hide, but the next generation it will come out. Okay. So next, myth number 6. The most important risk factor is the number of relatives who have had breast cancer. Yes or no? Next, no. The most important is not the number of your relatives, but at the age of the occurrence is more important. So early age of diagnosis is a red flag for hereditary breast cancer. Therefore, if your doctor asks, you have a family history, my sister has a breast cancer. Ano ba next? Tinatanong yung doktor sa'yo. Kumusta naman siya? Okay ba? Yung iba say, hindi, namatay na eh. Tapos, hindi, okay pa siya. Ayan, okay? So, and the next question your doctor will ask, ilang taon ba siya yung nakakuha yung breast cancer? Okay? At the back of our mind, that is very important because once hereditary breast cancer, when you are 45 years or younger, it happens when you are 45 years old or younger and you had that breast cancer, even among your relative. The strategy now, we will ask you to have a genetic testing because this is the consider, they call it breast cancer in the young. And you might be part in the hereditary breast cancer group. Okay? So, very important. Ano yung age of occurrence? Ayun nga, sinabi ko na sa'yo, is 45 years old or younger, because that is the key there now. Okay, just recently lang ito, the data. Okay, before they said, young, yeah, but young. Ano ba young? 19, young, yeah. But how often do you have a 19 years old with breast cancer? Diba? But can it? Yes. But it's maybe 0.0001%. Now, with the new data, we consider breast cancer in the young when they are 45 years old and younger. Okay, so that is usually we will advise you to undergo genetic testing, the BRCA1, BRCA2, and other genetic genes of the breast cancer. Next. Myth number 7. Once diagnosed with breast cancer, an immediate surgery is needed to prevent spread. What do you think? Yes, no. Breast cancer is not an emergency. Unlike kung binaril nyo, kailangan mo yan kasi mamamatay na yun kung hindi mo operahan, di ba? So, breast cancer, no. Once the diagnosis with breast cancer, as I told you earlier, if your doctor said, sige, schedule na kita for operation, teka. Now you know it's not an emergency. Let's discuss it first, di ba? Oh, baka mamaya mag-spread siya, ganyan. Well, I'm not, but the fact is, you have much time to discuss it first with your team, with your family. Okay? Most cancer, 1 centimeter insides have been there for a couple of years. You know, the division of one cell into become two, two become four, four become eight. It needs around, well, the data said is between 20 something days up to 3 months. Yung division, yung from 1 into 2. So when it was detected, when you consulted your doctor, nakapan mo na yung buko, 3 centimeter. It has been there for a couple of months or years. Okay, so that is the most important awareness. That's why the breast cancer month awareness month. So you should be regularly checking with your doctor, because the earliest discovery is equals to cure. Okay, a second opinion can be extremely valuable to learn the details. Okay, so MDT. Ask your doctor. Have it discussion first. Huwag kang maniwala. Operahan na kita. Baka makakalat na yun kung di operahan natin bukas. Teka. Huwag muna. No? Breast cancer starts when one cell becomes malignant and begin a doubling. Ayan. Sinabi ko na nga sa'yo yan. No? Doubling process that continues until it reaches a size that can be detected by breast exam. Okay, so next. Mammography is painful and can harm the breast. Yes or no? No. It can be uncomfortable, but it's not harmful. Okay? And it's not usually painful, although pain is something subjective, di ba? Kasi meron yung, some of us has low tolerance for pain, some okay lang, di ba? Parang ganyan. But you see the advantage to have a mammography, it's to detection early, especially the microcalcification that is not palpable. No, don't wait until it becomes palpable. You have to get it at the earliest sign. Okay, so significantly important to mammography. Next. Ito, common ask ito eh. Using deodorant, can it cause breast cancer? Yes or no? Next. No. Although there has been some reports that chemicals found in deodorant and antiperspirants can enter the skin and cause changes in breast cells, but the research to date does not support a link. So there is no really a scientific basis. So there are some reported, but when it was tested, inconsistent yung findings. So, in general, No. Okay, next. Wearing a bra can cause breast cancer. Okay, yes or no? Answer, no. Don't worry, you can keep wearing your bra if you want. No? Scientific evidence does not support a link between wearing an underwire bra or sports bra, no? Yung iba may sports bra and breast cancer is. So walang evidence, no? There is no biological reason why the two would be linked. Okay? So in short, I just add trauma. Alam mo, nasiko. Okay? By accident o nasipa yung yung baby niya, yung mga ganyan. Tapos ngayon may bukol na. And 6 months later nagpa-consult. Alam mo dati kasi doc na nasipa ito. Trauma does not have any relationship with the breast cancer. Okay? So not because of the trauma binugbog or nahulog lang by accident natamaan yung breast into steel, railing, ganyan. Tapos sabi mo, ba may bukol. But bakit persistent siya after 1 month, nandyan pa rin yun? No, it's not related to trauma. Next. Yan. No? Yun yung answer. Yes or no? No. Next. No? Well, we never would want to get hurt, but there's no evidence to support the link between trauma and risk of breast cancer. Cancer is an abnormal changes in the cell, in the breast cell. Not because sinuntok o nabugbog, nagbabago yung cell mo. No, the normal cell, kahit na you have bruises, it will recover normal. But the cancer cell is different. So there is no risk between trauma and breast cancer. Next. Dami na myth. Oh. If a woman is pregnant, she cannot get breast cancer. Okay. No. Breast cancer is actually the most common cancer in pregnant and postpartum women. Yeah? Because usually they 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 are masked, no? Because, di ba, during pregnancy, the breast has some changes, no? So they become heavier, they become swollen, and things like that. Sometimes hindi mo makakapa kung may bukol, no? So, and then in postpartum naman, when women are pregnant or breastfeeding, their breasts are naturally more tender. Okay? Next. So meaning, whether you're pregnant or not, the same risk mo. You can have breast cancer. Is breast cancer the number one enemy of women? Because you see the data, di ba? Yes or no? No. The number one enemy is not the breast cancer, but the late detection. Because if breast cancer detected early, it can be equals to cure. Huh? Not the breast cancer, but the early detection, the late detection is yung kalaban natin. Yun ang enemy natin. So that's why I advise all of you, you should be aware. And kahit na walang complaint, punta na kayo, pa-check din. Ha? Because the early detection is equal to cure. So, next. 14. We do not know how to prevent breast cancer. Yes or no? Answer. Yes. There are factors associated with increasing risk of breast cancer and certain factors that decrease the risk of breast cancer. But we do not know how to prevent it. Diba? Kasi hindi natin alam how to prevent it. We can only not to prevent, but either decrease the risk. Present factors known to contribute to overall breast cancer risk are mostly uncontrollable, like your age. Okay, the older you are, the higher your risk. Because if you look, the incidence of breast cancer, it happens within that age, 40 to 65. That is where the peak of where the breast cancer incidents happen. So your age is a factor that you cannot change. Okay? Your personal and family breast cancer history, you cannot change that. Di ba? Uncontrollable yan eh. Genetic factor. Early menarche, and then menopause up to 55, breast size and race. Okay? So, we do not know how to prevent breast cancer. Yes, we do not know eh. Because there are factors that you cannot control and you cannot prevent. Di ba? So, what you can do is decrease the risk. Decrease the risk. Next. Myth number 15. Everyone who has a positive BRCA1 or BRCA2 test result will get breast cancer. Okay. This issue become popular, di ba? Because of Angelina Jolie. Angelina Jolie issues na mastectomy siya, prophylactic mastectomy, both left and right. Because Angelina Jolie has a BRCA1 positive genes. Okay. Now, remember, BRCA1 positive genes, not only breast ito, it's also ovarian. So, na ano din, oophorectomy din si Angelina Jolie. Both. So, this is the answer. No. About 12% of women in the general population will develop breast cancer sometime during their lifetime. In the general population, okay, so walang history to. Patient with BRCA1 or 2 mutation appear to be up to 5 times higher, no, than women without the mutation. A positive test results will provide information only about a person's risk of developing cancer, but cannot tell whether this individual will develop cancer or not. Okay, so about 90% of women who develop breast cancer do not have inherited gene mutation. Okay, so in short, what are the risks? Just give you additional information. If you have a BRCA1 or BRCA2 gene positive, you tested, diba? Turn out to be you are positive. Syempre you are worried that you're gonna have a breast cancer. No, not necessarily. But the risk is very high because the data have shown your risk up to the age of 70 is around 70 to 77%. So, ganyan kataas. So that's why as you grow older, your increase is higher and higher, no? And beyond 75, very little na yan, risk. But you never free from a risk of having breast cancer. Di ba? I told you the most important is being a woman, being a female. That is the highest risk. Do we have a breast cancer in the elderly? Yes. That is one of the topic usually discussed. What should we do in the elderly patient with breast cancer? For example, 85 years old, 90 years old. Diba? We do have that. So your doctor should be able to explain to you. The treatment approach is slightly different, but in general, it has been discussed earlier with you guys. Okay, next. Okay, HRT, hormone replacement therapy, increase your risk of breast cancer? Yes or no? Remember before you postmenopausal, they give you injection, diba? Because of when you start menopausing, then syempre kulang na yung estrogen hormones. Then they give you hormone replacement therapy because your skin become dry, diba? And you aging process mo is faster because lack of estrogen
So,
hormone.
labas na pala si Noknok.
And then, so that's why we give estrogen, synthetic estrogen. They call it the hormone replacement therapy. But sige, answer next. Okay. The answer, yes. The HRT, hormone replacement therapy, will increase your risk of breast cancer. It has been studied. So if you look at, according to the Women's Health Initiative, this is the landmark study. So postmenopausal hormone therapy trials showed that estrogen and plus progestin replacement therapy increase the risk of breast cancer, along with heart disease, stroke, and blood clot. This Women Health Initiative is done in the US. No? Imagine that they study 161,000 plus women, no? And so that's why, because of this study, HRT is no longer routinely done. No? There is a specific reason that you still can use that. Okay, there was a 24% increase based on that study. That cannot be doubted anymore. They are so their subject is 161,000. So that's why it's a game changer yun after this study. Okay, I think that's my last. Next, thank you. I think I
Okay,
stopped
thank
there.
you. Thank you so much, Dr.
Okay,
Gonzali.
okay.
So I really enjoyed your talk because
Ay, nako.
I learned a lot, and also important for us, even as OBGYN, to listen to the facts and the myths of breast cancer. And I can tell, listening to you, that I can feel the knowledge and experience now when you
Thank
talk.
you, thank you.
Parang we we know that you're very experienced in the field and a leader in the field also. So I
Okay.
think we still have time for some questions. So in your one of your last slides, you were talking about BRCA
Yeah,
mutations, right?
yeah.
BRCA1, BRCA2, and then that could be